Namaste. This is Dr. Vaishali Ashok Bhide, MD Homeopathy. Today we are talking about frozen shoulder. In medical terms, frozen shoulder is called as adhesive capsulitis. So what actually happens is the capsule around the shoulder joint is the one which gets inflamed. So let's go into the anatomy of the structure initially. Our shoulder joint is a ball and socket joint. So this is the area of the glenoid cavity where the ball of the shoulder fits, and that's how all the movement happens. Around this is a capsule, and this capsule is the one which is going to be affected in a frozen shoulder. What happens is initially there is inflammation of the capsule. Therefore, whenever you try to move the shoulder, because it is covering the entire shoulder joint, there is pain, and because of this pain we limit movement, and because the movement gets limited, this inflammation finally is the tissue is replaced by a fibrous tissue. So what happens is after the pain comes the stiffness, because the tissues are getting replaced by a non elastic tissue, that is a fibrous tissue. After that, as we continue to give rest to the part, because there is pain, it becomes frozen, that is it tends not to move at all because it has become stiffened or hardened, as you can say. So these are the stages in which a frozen shoulder will move. First there will be pain, then there will be stiffness, and then the state which we called frozen. So what is the cause for frozen shoulder? The commonest cause is a physical trauma where the process has started. It is more common in females as compared to males. It is also common after the age of 40 years, or rather between 40 to 60 years of age. So let's see what are the symptoms of frozen shoulder. Initially, when the problem has just begun, that is the time when little pain is experienced on certain spots of the shoulder. This pain later becomes very severe, so much so that they are not able to lie on that side while they sleep, or it is a pain which will disturb their sleep. Later, they realize that they are unable to lift their hand without pain. Therefore, they stop or reduce the movement of their hand, which is painful, and this in turn causes more stiffness. So now they have pain and stiffness both, which they are suffering with. Normally they are difficult, they will move their arm till here, they will lift it. Beyond this is most painful, and that is how frozen shoulder causes decreased movement, pain, so much so that they say this is completely frozen. Here, apart from pain, mundane activities like combing your hair or dressing yourself also become very painful. For them to lift a heavy utensil also becomes a task. So these are the common symptoms of frozen shoulder. Now let us consider the treatment of frozen shoulder. In treatment of frozen shoulder, it is very important that they do regular physiotherapy or exercises. As we have seen, it is the pain which started causing limiting of the motion, which resulted in the stiffness. So it is very important that you start doing your exercises and moving that arm again, so that it can be healed. So first and foremost, when we give homeopathic medicine, we see to it that we ask them to start their basic physiotherapy exercises. Secondly, we give homeopathic medicines. Without medicines to bring frozen shoulder or to treat a frozen shoulder and make the patient pain free is difficult. If it is allowed to run a natural course, it may take 3 to 4 years for the patient to get better only on physiotherapy. However, with medicines, the process can happen much faster. So we take a detailed case of the stress that the patient has gone through, any history of trauma, how the trauma has occurred, and how they have treated themselves immediately after the trauma. That will decide what is the treatment part and what speed do we expect from the treatment or from the recovery. So once medicine is selected, we will give two types of medicine. One is for the acute pain, because it is the acute pain which is going to stop them or prevent them from doing their exercises. So there are two medicines selected. One is for the acute pain and one is for the inflammation which was there. So once the medicines are prescribed, the pain reduces, the stiffness reduces, and they become pain free and their range of motion increases. So while we are seeing their follow-ups or when they come after taking the medicine, the first thing we ask them is the intensity of the pain, and second is if they can move a little more, if the range of motion or their mobility has increased. When the mobility has increased, we know that we are on the right track. And this is how frozen shoulder is treated. Although it looks like a very localized thing, the pain is enormous and disturbs day to day activity of the patient and even his night sleep. So it is very important to treat it at the earliest. And the earlier you start treatment, the easier it becomes, because then there is less inflammation and less fibrous scarring of the joint. Capsule. I am currently practicing in Dadar West, Shivaji Park area at Saplace Polyclinic, Malik Building, D.V. Deshpande Mark, Shivaji Park, Road number 4, from 10 a.m. in the morning to 7 p.m. in the evening. You can also follow me on Facebook and Instagram. You all must be aware that I had published my first book on homeopathic medicine titled Unlocking the Bogus Synoptic Key Part 1. I am very glad and delighted to inform that I am soon publishing the second part of the book, Unlocking Dr. Bogus Synoptic Key Part 2. Thank you very much. Stay happy, stay healthy, stay blessed.